In this video, I'm going to be talking about motor neuron disease. Motor neuron disease can be defined as a family of progressive neurological disorders centred on the destruction of motor neurons. Motor neurons are nerve cells located in the brain and spinal cord responsible for voluntary muscle movement, such as walking, speaking, swallowing, and breathing. Once the motor neurons begin to degenerate, they can no longer tell the muscles what to do. The muscles will therefore begin to weaken, stiffen, and waste. Because of this, the individual's ability to walk, speak, swallow and breathe may become impaired. So what are the different forms of the disease? There are 4 types of motor neuron disease, these being amyotrophic lateral sclerosis, progressive bulbar palsy, progressive muscular atrophy and primary lateral sclerosis. They are classified by the neurons in which they affect, either upper or lower. Upper motor neurons start in the brain and control movement, whereas lower motor neurons connect to the muscles and make them move. Amyotrophic lateral sclerosis is the most common form of MND. It accounts for 60 to 70% of all cases and affects both the upper and lower motor neurons. Early signs of ALS include tripping up and or dropping things. As ALS progresses, symptoms such as muscle weakness and difficulty speaking, swallowing and breathing may arise. Progressive bulbar palsy accounts for 20% of all MND cases. Bulbar refers to an area at the base of the brainstem called the medulla oblongata. Progressive bulbar palsy therefore involves the degeneration of the upper and lower motor neurons that extend from the brainstem. Notably, these motor neurons are responsible for the movement of the bulbar muscles, i.e. the muscles of the face. Early symptoms therefore include slurring of speech, difficulty swallowing, and muscle twitches in the tongue and face. Progressive muscular atrophy accounts for 10% of MND cases and affects only the lower motor neurons. Muscle weakness, muscle atrophy, and muscle twitches are associated with this type of MND. Primary lateral sclerosis accounts for 3% of MND cases and in contrast affects only the upper motor neurons. Associated symptoms therefore include muscle stiffness, particularly in the legs. The exact cause of motor neuron disease is not currently known. It is important to note that it is a very uncommon disease with a 1 in 300 risk of being diagnosed with MND across a lifetime. Notably, MND primarily occurs between the ages of 50 and 60 and 2/3 of those affected are men. However, having a parent with MND increases the risk of developing the disease from 0.3% to 1.4%. These specific cases are termed familial MND and arise from mutations in the C9orf72 and SOD1 genes. Importantly, the risk of being diagnosed with MND does not appear to be impacted by race, diet, or the development of any other disease. It is also important to note it is not an infectious disease. So what are the symptoms of motor neuron disease? When motor neuron disease affects the upper motor neurons, usually in cases of primary lateral sclerosis, the muscles, primarily in the legs, will tighten, muscle tone will increase and reflexes will also increase. Muscle tightness is medically termed muscle spasticity and is the sustained involuntary action of muscle. Increased muscle tone means the faster the muscle is moved, the more it resists movement, causing stiffness, pain and a reduced range of motion. When motor neuron disease affects the lower motor neurons, the muscle will begin to waste, twitch and reflexes will decrease. This is most commonly observed in progressive muscular atrophy. Atrophy means waste. Another symptom of motor neuron disease is dysphagia. This condition is characterised by difficulty eating, drinking and swallowing and occurs in 80% of MND cases. Dysphagia is caused by damage to the motor neurons involved in swallowing, which subsequently leads to weakness in the throat and mouth muscles. Dysphagia is recognised as one of the earliest symptoms of progressive bulbar palsy and one of the later symptoms of ALS. Identifiable symptoms of dysphagia include coughing while eating or drinking, nasal regurgitation, weight loss and excessive salivation. A comprehensive care approach, including a dietitian, a speech and language therapist, a physiotherapist and a consultant gastroenterologist is recommended for the management of dysphagia. Most, but not all patients with motor neuron disease will experience a symptom called dysarthria. Dysarthria is a motor speech disorder characterised by reduced intelligibility of speech due to atrophy of the bulbar muscles, i.e. the muscles of the face. Slurring of speech, a change in your voice, difficulty controlling the volume of your voice, and difficulty moving your mouth and tongue are all indicators of dysarthria. The respiratory system is responsible for helping you breathe by bringing oxygen into the body and removing carbon dioxide. If the motor neurons controlling the respiratory system are damaged, the respiratory muscles will begin to weaken, stiffen and waste, making it significantly harder to breathe. Respiratory symptoms typically appear in the later stages of the disease. Because of this, breathlessness may be more difficult to identify, as patients usually lack mobility by this stage. It is therefore recommended to look for nighttime symptoms as an early indicator of respiratory dysfunction. This is because shortness of breath when lying down causes a build-up of carbon dioxide. Signs to look for include an irregular sleep pattern, waking up with a headache and/or confused, and being difficult to rouse from sleep.